I'm here today to introduce you to a remarkably promising new therapy for traumatic brain injury. We now know that the chemical changes that happen in the brain after TBI are also present in other forms of neurodegeneration, such as Alzheimer's disease. The difference, of course, is that Alzheimer's progresses over a long period of time. We view TBI as a human model for neurodegenerative disease, and why we expect that our success in treating TBI will lead to a treatment for Alzheimer's disease and other forms of neurodegeneration. There are no FDA-approved therapies for TBI, and the handful of FDA-approved drugs for Alzheimer's don't alter the course of the disease. As the Earth's population ages, neurodegenerative disease will bankrupt healthcare systems.
I have conducted decades of research to find new drug strategies to treat traumatic brain injury and Alzheimer's disease. I worked with Nobel laureate Dr. Julius Axelrod, who believed that we can find new drugs by understanding how the brain works.
My focus in the biopharmaceutical industry is developing new therapies and helping companies like ALSP develop life-changing new medicines for patients. Our lead compound is derived from a drug that has already undergone clinical testing in numerous patients. Until now, it's been challenging to develop drugs for TBI because there was no clear-cut regulatory pathway. We'll have an innovative pathway to develop new therapies for TBI thanks to the hard work of Dr. Dallas Hack's team in collaboration with the FDA.
I am Dr. Dallas Hack, and I recently retired as a colonel in the U.S. Army. While in the Army, I directed the Combat Casualty Care Research Program, which funded more research in traumatic brain injury than any entity worldwide. That involved hundreds of projects, thousands of proposals, and almost $1 billion in funding. That included drug trials, diagnostics, and other assessments for TBI. I am pleased now to have joined forces with ALSP because the strength of their research has shown that a common pathway in the cascade after a traumatic brain injury can be inhibited by a class of drug candidates with an extensive safety profile in humans. I am working with a team of experts and the FDA to define better ways to test treatments for traumatic brain injury. We are working on better ways to categorize patients to enroll in the studies and better ways to measure the response to those treatments so that we can finally have successful clinical trials in treatment for traumatic brain injury.
The vast majority of people living on the earth today are touched in some way by neurodegenerative disease. This is your chance to help us change that.